I feel overwhelmed. And I think I would best describe this as trying to get socks on an octopus. I mean, this is, there are so many layers to all of this. So I know it's not easy to simplify, but I would ask each one of you to identify a cost savings that really puts a dent in the system. I mean, you've done a marvelous job of telling us all the things that are broken. And, you know, the stories from consumers, all of that. Hardworking law enforcement people. I mean, this affects everyone. Everyone. No one skates away from this. We're human beings. Our bodies need care. Some need more, depending on their age. Some are afflicted with serious illnesses. Others really don't even get to pay down their deductible because they don't use that much in health care, and yet they're paying through the nose. So why don't we start with you on the left here?
I would
One
say
thing. One thing.
Increasing competition, reducing consolidation.
In the short term, site-neutral payments or reforming Medicare Advantage.
That what? I'm sorry.
In the short term, either site-neutral payments in Medicare or trying to reform Medicare Advantage a little bit.
Access to claims data so we can tell what we're paying for services.
And do you think that the legislation that we have passed in the House addresses that fully?
Ranking member, I am cautiously optimistic, but you talked about an octopus. That's how I refer to the Hospital Association. They'll figure a way around it.
I would say, without a doubt, price transparency in the short term and enacting site-neutral payments, real savings to people right now, and then we work towards longer-term solutions around building, reducing consolidation, improving competition in the markets.
What do you think the site neutral addressing that issue, what's your estimate of reducing overall costs?
My understanding from the estimates is there's a range, but it's about $150 billion over 10 years for a comprehensive site-neutral package to what the Medicare Advisory Payment Commission is recommending. And then that includes about $94 billion in savings directly to Medicare beneficiaries.
And CBO doesn't recommend policy. We don't advocate for policy. But in the score of the Lower Cost, More Transparency Act, expanding site-neutral payments in Medicare is a saver. Increased transparency is a saver on many dimensions. And the site-neutral policy that's in Lower Cost, More Transparency is pretty narrow, but the more expansive version of site-neutral policy we expect could have some dampening of the incentives to consolidate, and that could spill over to what commercial insurers pay and negotiating leverage.
Dr. White, I want to thank you and CBO's Office of Health Analysis for your superb work. You and your staff have lent really tremendous expertise to my office, and I think that you're an invaluable part of the legislative process. So all of my thanks to you. Thank you to each one of the witnesses. We, you know, the price tags that we've called out in our opening statements, what you all have referred to in some part of your testimony, seems so overwhelming. And yet I'm struck by piece, 1%, 2%, 3%, in terms of projected savings, you know, depending on what it may be. So it seems to me that there's not one blockbuster policy that is going to, you know, move us in the direction that we all want to move to. I think it's a series of them, but thank you for being here. Thank you for your testimony. I yield back.
Can I have your 7 seconds?
Sure.
So we have to also balance as we deal with this. We do have the best hospital system in the world, so it's a lot of things we have to factor in as we move forward.